Hi. So let's do the second type of receptor, which are the G protein coupled receptors. So we've done till now the ligand gated receptors, in which we did the important examples of nicotinic receptor, which is the receptor for acetylcholine, and it has a chloride ion channel. And we did for the GABA again, they are like the GABA attaches to these receptors, or whereas drugs are there like barbiturates, benzodiazepines, they again increase the conductance of the chloride channels through them. Then we had the NMDA receptors, which are receptor for glutamate, and then when glutamate binds to these receptors, they will help in the movement of the sodium and the calcium ions from outside to inside. So, and they are the fastest acting receptors. The action occurs in milliseconds, right? Then next, speed wise, we have the G protein coupled receptors, and they are one of the most important receptor types out of all the four. Okay, they're common and they're very important. And the thing about these are that they are called G protein coupled receptor. So अगर हम break करके इसको करें, तो there is a G protein which is coupled with the receptor. वो receptor के साथ bound होता है. The structure of G protein coupled receptor is like it is 1, 2, 3, 4, 5, 6, 7. 7 times it goes, they are the cell membrane receptors, but 7 times they are going like this, ठीक है? By transmembranely 7 times जाते हैं. तो और इस end पे there is a special type of protein attached, and this is called as the G protein. ये G protein है, और G protein के 3 parts होते हैं. There is alpha part, there is beta part, and there is gamma part. So this is the structure of a G protein coupled receptor. And because of such a peculiar structure, we have different names, other names for this. It looks like a snake. So they're also called as serpentine receptors. Okay? Serpentine receptors. They're also called as metabotropic receptors. So if the question comes on metabotropic receptor, means you have to write about the G protein coupled receptors. And they're also called as 7-pass receptors. Not very common, but yes. 7-pass receptors, because they pass through the membrane 7 times. 7 pass. So these are different names given to the same receptor, G protein coupled receptor. Now, out of these 3 parts, alpha, beta, gamma, alpha is the most important. Okay, most of the reactions they occur because of this alpha part. Now, this G protein, ये सारा G protein है जो this thing, whether it is ये alpha है, beta है, gamma है. This is the G protein, and they can be of various types. So here, if I go, they can be GS. GS means GS stands for they can be G stimulatory receptors. They can be GI, G inhibitory receptors. So when they are stimulatory, they stimulate the formation of the cyclic AMP, increase in the cyclic AMP. They cause a decrease in the cyclic AMP. Inhibitory is opposite. Then we have a GQ type. GQ type, they stimulate another enzyme, phospholipase C. Then we have a GO type. It almost functions like a GI only. So basically, it is involved in the channels. So they can increase the potassium efflux, right? Okay, through the channels, or they can decrease the calcium influx through the calcium channels. Okay, so this is GO type. Almost like GI. GI के साथ ही होता है usually. कई बारी they function whether they are increasing the potassium efflux or not. So most important, we have the GS, GI, GQ, and some amount of the GO. So different types of receptors can have different types of G proteins attached to them, and the response occurs therefore. Right? Okay, let's go to the first two, which is the GS and the GI. So let's do the G stimulatory first, and then we are going to do the G inhibitory. Now I told you that the G जो 3 proteins लगे होते हैं उसमें अगर हम यहाँ बात करें, this is the serpentine here receptor. So 1 2 3 4 5 6 and 1 2 3 4 5 6 and this is a 7 times. So यहाँ पे फिर we have the G protein attached. So this is alpha, beta and gamma. Now when it is in inactive state, there is no ligand attached to the G protein, then usually जो यहाँ पे alpha के साथ पे GDP attached रहता है, ठीक है, GDP. और जब activate हो जाता है, activate का मतलब है when there is a ligand or an agonist attaches to this G protein, it becomes activated and it will also activate the G proteins. So then what happens is this GDP goes away and instead GTP gets attached to the alpha subunit. So GDP dissociate हो गया और GTP is replaced in place of GDP on the alpha subunit. एंड ये जो 3 सब यूनिट है ये भी आपस में टूट जाते हैं, तो क्या हो जाएगा, यहाँ पे एक अल्फा अलग हो जाता है और जो बीटा गामा है, लेट्स से हियर इट इज द बीटा, इट इज द गामा, ये अलग हो जाते हैं और अल्फा के साथ द जीटीपी इज अटैच्ड. ठीक है, सो दिस इज हाउ दे डिवाइड. सो अल्फा जीटीपी गो द अदर वे, दे जस्ट सेपरेट, एंड beta gamma they go the other way, they separate. So now they are no more friends together. ठीक है, so alpha has found a new friend GTP, it has separated from its older friends beta and gamma. Now in the GS type, ये जो beta gamma वाला है part, it has no function, it doesn't do anything, it is sitting all gloomy and sad and angry that alpha has left it. It says I will not do anything, it doesn't do any work. But because alpha is very happy and it has found a new friend, it's going to do a lot of things now. It's going to play and enjoy and do a lot of effects. So the first thing it does is basically this is going to stimulate the enzyme called as adenylyl cyclase. Okay? In the cell. In the cell it is going to stimulate adenylyl cyclase, and जब adenylyl cyclase stimulate होता है, इसका function है to convert ATP into cyclic AMP. ठीक है, सो साइक्लिक AMP हियर इज बेसिकली द सेकेंड मैसेंजर. ये मैसेज अब कैरी करेगा एक्टिवेशन का. ठीक है, इट विल कैरी द सेकेंड मैसेंजर कैरीज द मैसेज एंड इट इज गोइंग टू प्रोड्यूस द इफेक्ट्स नाउ. सो हियर साइक्लिक AMP इज द सेकेंड मैसेंजर, वेरी इंपॉर्टेंट. यूजुअली फर्स्ट मैसेंजर्स हम एगोनिस्ट को ही कहते हैं जो यहाँ पे बाइंड करता है टू द रिसेप्टर. And the second messenger, which is carrying the message further to produce the response, it is called as a second messenger. So this is the cyclic AMP here. So cyclic AMP is going to stimulate another type of protein. This is protein kinase A. It is going to stimulate this proteins, and this is going to produce the further, because it is stimulating it. ये स्टिमुलेट हो गया, इसने और सारे प्रोटीन्स ने अपने इफेक्ट करने शुरू कर देने. वेदर ये एंजाइम्स को, फर्दर एंजाइम को स्टिमुलेट करता है, वेदर ये आयन चैनल्स को स्टिमुलेट करेगा, वेदर ये वेरियस ट्रांसक्रिप्शन फैक्टर्स को स्टिमुलेट करेगा और आगे ट्रांसपोर्टर्स, व्हाटएवर द इफेक्ट. सो ये सारा इसका रिस्पॉन्स है. कुछ भी रिस्पॉन्स इसका जो है, इट इज वाया प्रोटीन काइनेज ए. सो द रिस्पॉन्स इज प्रोड्यूस्ड. व्हाट एल्स प्रोटीन काइनेज ए डज, it also stimulates these calcium channels. So more calcium is going to move inside. And when calcium moves inside, more positive charges being carried inside, it is going to lead to another excitation of the cell. ठीक है, अगर contraction है तो contraction होगी तो excitation of the cell basically. So this is going to happen with the help of GS type, G stimulatory protein. So classical example of this type is the beta 1 receptor, which are present in the heart. They are the GS type. So when it's agonist, which is the adrenaline, and it is going to stimulate the beta 1 receptor, which is a G protein coupled receptor, it is going to go through all these effects, and ultimately it's the calcium andar aa raha hai. It is going to cause increase in the heart rate, and it is also going to cause increase in the force of contraction. So this is going to be the effect of beta 1. So what we see is when you give a beta 1, beta 1 देते हैं तो agonist, तो heart rate बढ़ता है, force of contraction बढ़ता है. अब वो कैसे बढ़ रहा है? By these few steps which are actually going on inside. So important here, a cyclic AMP, which is the second messenger, and ultimately the response is produced, increased heart rate, force of contraction. Now coming to the other side, which is the GI. GI simple याद रखना, it is G inhibitory. इसने GS के steps को inhibit करना है. We don't need to remember a lot of things here. So here जो alpha GTP इसका है, इसका effect सिर्फ इतना है, it is going to inhibit this adenylyl cyclase. So when the adenylyl cyclase is inhibited, so ये जो सारे reactions हैं, none of the reactions are going to take place. ठीक है? So it is basically going to just inhibit the adenylyl cyclase. So there will be decrease in the cyclic AMP production. So all those reactions are not taking place. And what does here? There is a role of beta and gamma. Beta and gamma here are not sitting quietly. They are going to do something. So this is beta and gamma subunit. They are going to stimulate these potassium channels. So when these potassium channels they are stimulated, they are going to increase the outflow of potassium ions. Okay, so they are going to increase the potassium efflux. बाहर निकालते हैं potassium को. So when they are going to cause the potassium efflux, that means inside there is increase in the negative charge, because positive charge बाहर जा रहा है, so there is increase in the negative charge, which leads to hyperpolarization, and therefore there is inhibition of the cell. So that's why they were causing. That's why they are inhibitory. So they are causing adenylyl cyclase inhibition, decrease in cyclic AMP, and they are also causing the hyperpolarization of the cell. And the classic example here would be a muscarinic M2 receptor, which is again present in the heart, and it is functioning opposite to that of the beta 1 receptor. So it causes a decrease in the force of contraction. Right? So both are present in the heart. So BAT has a sympathetic stimulation, a parasympathetic stimulation. So when the sympathetic ones dominate, there is increase in the heart rate, force of contraction, or when you give a drug which is causing this. And when you're giving a parasympathetic drug which is acting on the M2 receptor, so there is decrease in all the other parameters like force of contraction, heart rate and all that, that will decrease. So this is important about the GS and GI type. Right? Now let's go to the third type, which is the GQ. Now if we go to the GQ type here, again you will see that we have this alpha attached to the GTP. So alpha here is attached to the GTP, and this is going to stimulate a different type of enzyme. If it is GQ, this is phospholipase C. So phospholipase C is present here in the membrane, and what it does is यहाँ पे in the membrane we have PIP2. ठीक है? PIP2 present होता है inside the membrane, phosphatidyl inositol phosphate 2 type, and is present in the membrane, and it gets divided into two: diacyl glycerol DAG and IP3. ठीक है? Inositol triphosphate. So this is diacyl glycerol and IP3. So in this condition here, or in this situation in GQ type, these two are the second messengers. They are going to carry the reaction forward, IP3 and DAG. Now DAG actually remains inside the cell membrane only, while IP3 comes out, and it is going to then go into the endoplasmic reticulum, especially because if we're talking about the smooth muscles here, let's say smooth muscles mein hai, because histaminic receptors are present in the smooth muscles, H1 if we're talking about that. So they are entering into the smooth muscles, and in the endoplasmic reticulum there are calcium stores. So IP3 leads to increased movement of calcium from the endoplasmic reticulum to the outside. So calcium is going to move out. Now this calcium is going to combine with calmodulin, which is present here. And when the calcium calmodulin complex is formed, it would lead to the response in the form of smooth muscle contraction, and if these are glands, it leads to glandular secretion. So these kind of responses are going to occur. In this here, I would like to just stress on this one that यहाँ पे हम ये जो calcium है, इसको हम कई बारी we also call it as the third messenger list. So here we have three messengers. The first messenger is always the agonist, the ligand. Second messengers are usually in this case वहाँ पे cyclic AMP था, and यहाँ पे IP3 and DAG है. And in this case we also have a third messenger which is further carrying the message of causing the smooth muscle contraction and the glandular secretion. Okay? So they can also lead to further increase in the the calcium channels है वो भी अंदर आके खुल सकते हैं, and then can lead to more movement of calcium inside. यहाँ पे अगर channels हैं, so more calcium they can even lead to trigger that, stimulate कर सकते हैं. More calcium is going to enter and produce the same response. ठीक है? So extra वाले भी हम exchange हो जाते हैं. So this is a response which is produced by GQ. So these are the three important messenger or transducer systems for the G protein coupled receptors. Please, let's be very clear about them. There are three types, and here if I just revise that they are the serpentine 7 membrane receptors, 7 pass receptors, metabotropic receptors. These are 4 types: GS, GI, GQ, GO, stimulate, inhibitory, GQ and GO. ठीक है, stimulatory इनमें opposite effect है S और I का. One increases cyclic AMP, the other decreases the cyclic AMP. GQ is going to stimulate the phospholipase C, GO. They are only involved in the channels and usually function like GI. So this is what is the first step here is when the GTP, when suppose jab agonist lag jata hai, then GTP is going to replace the GTP and it is going to attach with the alpha subunit. Alpha is the most important subunit, is going to attach with this, and alpha and GTP are going to dissociate. Beta gamma, all जो पहले friends थे alpha beta gamma, वो because new friend मिल जाएगा alpha को GTP, it is going to leave beta and gamma. Beta and gamma are very unhappy, very sad. They say I'm not going to do anything. All the work is done by the alpha and the GTP. ठीक है? So they are going to stimulate the adenylyl cyclase enzyme, which is going to produce cyclic AMP. Cyclic AMP here is the second messenger, which is going to carry the message, and signals are going to be amplified. अगर एक मॉलिक्यूल लगता है तो बहुत सारे रिएक्शंस आगे प्रोड्यूस होते हैं. दिस इज कॉल्ड एज एम्प्लीफिकेशन. So it stimulates the phosphokinase A and the response you get. So classic example is beta 1 receptors in the heart. GI में आपको इतना याद रखना है. The example is this M2 receptors in the heart, which has an opposite effect to that of the beta 1 because there is inhibition of the adenylyl cyclase. And इसमें जो बीटा एंड गामा है, they say enough, हम भी enjoy करेंगे. Why only alpha is enjoying? So they are going to cause problems for alpha. वो कहते हैं कि अब हमने उल्टा काम करना है, हमने डिप्रेस करना है, इनहिबिट करना है सिस्टम को. ठीक है? So what they do is they increase the potassium efflux. They act on potassium channels, तो इसको बाहर भेज देते हैं ताकि यहाँ पे नेगेटिविटी बढ़ जाए अंदर. So negative inside, and it's gloomy and negative, and it's cause hyperpolarization and depression. This is a GI. Then the GQ is totally different. Right here, this is a GQ. There is totally different mechanism than the above, and यहाँ पे what the alpha is going to do, it is going to stimulate the phospholipase C, which is present in the membrane, cell membrane, and वहाँ पे ये क्या करेगा, cell membrane PIP2 होता है, it divides into two, IP3 and DAD. So both of them are the second messengers here. ठीक है? And we have actually we have incomplete here. We'll just complete it. So IP3 is going to, what it is going to do, it is going to stimulate it is going to move calcium, it is stored in the endoplasmic reticulum, it is going to move it towards the outside, and this calcium comes out. Now ये जो calcium बाहर आता है, it is also now called as second, इसने आगे काम करना है. So this is also called as the third messenger, or it is going to combine with the calmodulin, and this is going to cause the further response, whether it is contraction of smooth muscles or glandular secretion. And यहाँ पे I want to make out the example here would be the H1 receptors in the smooth muscles. ठीक है? Smooth muscle contraction. अगर ये histaminic receptors कहीं पे glands में, तो it causes glandular secretion. Now this calcium here, what it does? So here if we continue in this part, they are also going to stimulate this diacylglycerol. और जो diacylglycerol ने आगे क्या करना है, इसने phosphokinase C नाम के प्रोटीन को स्टिमुलेट करना है. ठीक है? और ये फिर आगे प्रोटीन्स को फॉस्फोराइलेट करके then it produces the, so this one here. Let's just draw it here. This one. It is going to stimulate the phosphokinase C. So phosphokinase C, and it is going to produce phosphorylation and the response. So both of them are going to do their own kind of work. Okay? Phosphorylation of the proteins and the response. So this is about the G protein. GS, GI, GQ. I hope I'm clear, because these are very important concepts. And in the last here, there is a special type of, because there are new drugs associated with G alpha 12-13 type है. ये एक proteins को stimulate करता है, which are rho kinase. ठीक है? They are present in the smooth muscles. So when it stimulates this rho kinase in muscles, what happens? There occurs constriction. So यहाँ की vasoconstriction हो जाती है, angiogenesis हो जाती है, and proliferation. ठीक है? So all these things happen, and they can lead to pulmonary hypertension. ठीक है? And they are dangerous. This can lead to people. This can lead to pulmonary hypertension because of stimulation of rho kinase. So we have drugs which are going to inhibit the rho kinase, and when they inhibit the rho kinase, you can use them for pulmonary hypertension. We have a drug called as Fasudil. It can be used, it has been approved for treatment of pulmonary hypertension. Okay? There is another drug called as Nitarsudil, और इसको हम यूज करते हैं. Again, this is also a rho kinase inhibitor, but it is topically acting, and it has been used in some patients of open angle glaucoma. Okay? Yes, so these are two important drugs, which is Nitarsudil, Fasudil, and they are used for management of different types of diseases. One is for pulmonary hypertension, the other is topically used for open angle glaucoma. These are newer developments. So with this, we finish with the second most important type of receptor, G protein coupled receptors. And in the next lecture, we will be dealing with the last two types of receptors. Okay, thank you.